Welcome, I am Terry Tropin, and today I'm discussing the qualifier character 7 used to build a PCS code for the medical and surgical section. See the videos already posted on YouTube for an introduction to PCS digits 1 and 2, and others discussing root operations, body parts, approaches, and device. First, let me introduce myself. I have a master's in healthcare administration and informatics from the University of Maryland Global Campus, and have an RHIA and CCSP certification. Also, I'm an AHIMA-approved ICD-10 trainer. I've taught health information technology at Montgomery College for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines and translate them into regular English. My books include one on E&M coding, one on ICD-10-CM coding, ICD-10-PCS, and external causes. These are available on Amazon. Character 7 in an ICD-10-PCS code indicates the qualifier used. Qualifiers are different from the other characters in a PCS code because there are no specific guidelines for qualifiers. It's kind of a other stuff category. Qualifiers provide additional information related to the other characters in a code. Remember, not all procedures will use a qualifier. Remember that all PCS codes require a 7th digit. If there's no qualifier, you're going to use a value X, value Z, no qualifier. It's used with the other values listed here, all of these, to build a valid PCS code. Qualifier values include provide additional information or modify the meaning of the other characters used in a code. Here's kind of a summary of the different types of qualifiers. There are qualifiers that provide information on root operations, some that qualify the approach, the device, and body parts, including how many body parts are involved and the timing. Each of these will be discussed in this video. First, let's look at qualifiers used for specific root operations. These are when the procedure was a biopsy and when there's a specific method for the operation. So first, let's talk at biopsies. I think this is probably the most important, most often used qualifier. The qualifier is X, and it's defined as diagnostic, which means it's a biopsy. So if you're going to do a biopsy, you do excision, drainage, extraction, whichever is appropriate, and then the qualifier value says this was a biopsy, this was diagnostic. Here's an example. Fine needle aspiration biopsy of fluid in the lung. So the root operation drainage, removing fluid, and the qualifier value is diagnostic. So this is not for treatment, to take the fluid out to treat a condition. It's to take fluid out to send to analysis to figure out what the problem is. There are also root operations that provide information about how the root procedure was performed. So for example, the qualifier irreversible electroporation uses low energy electrical impulses to destroy tissue. So under destruction in the hepatobiliary system and pancreas, in the liver, you're going to have irreversible electroporation. That gives more info. It was destroyed. How was it destroyed? This tells you how, what methodology was used. Another one is cell suspension technique. This is used in skin and breast, as can be various areas of the skin, and it's skin replacement. This is when cells are taken from the patient, placed in a culture medium to multiply and create a tissue substitute. Notice that the device value is autologous tissue. So what happens is that the cell suspension, the cells created, are used in a spray or sheets of tissue to treat conditions such as burn, to replace the skin. So it's a replacement procedure. Another method is the qualifier value vertical. This is in the gastrointestinal system and used for a gastrectomy procedure. This is a specific gastrectomy called a vertical sleeve gastrectomy. You can see it's called a sleeve because what's left is kind of a long tube, and all of this is taken out. So it's to remove part of the stomach for weight loss. So it's gastrointestinal system, excision, stomach, and the qualifier vertical tells you what kind of excision was done. Here's yet another method. So this is for fragmentation procedures in the blood vessels, heart and great vessels, upper arteries, upper veins. So it's fragmentation, it's percutaneous, and the qualifier value is ultrasonic. So what happens is that instrument is put percutaneously to insert device to get it to a vessel, and then an ultrasound probe is used to fragment a clot. For example, percutaneous fragmentation of a clot in the pulmonary trunk. Okay, so this is heart and great vessels, fragmentation, body part is pulmonary trunk, that's where it's being done. The approach is always percutaneous, the qualifier is ultrasonic. So it gives a little bit more information about what exactly happened here. The next group of qualifiers I'm going to discuss are those that provide additional material about information about body parts. These qualifiers are used with body part values in these root operations: bypass, transfer, transplantation, creation, replacement, detachment, and resection. So first is bypass. A bypass, procedurally remember, is altering the route of passage of fluids, contents of a tubular part. So in the gastrointestinal system, the body part value is the area bypassed from, the qualifier area is the area bypassed to. So the body part works with the qualifier to give a picture of exactly what was going on. For example, open bypass from stomach to jejunum, the bypass is from the stomach, so that's a value 6. And it's to the jejunum, which is a qualifier value A. Here's another example of a bypass procedure in the gastrointestinal system. In this case, the qualifier value indicates the type of anastomosis used, such as cutaneous, meaning to the skin level. Gastrointestinal system, open bypass from stomach to skin level, cutaneous is A. So body part is bypassed from, the qualifier is bypassed to, and it's to the skin, it's cutaneous. So bypass is also used in the heart and great vessels category. The body part value is the area bypassed from, the qualifier area is area bypassed to, much like what we just talked about. So bypass from, and it's 2 coronary arteries, and we're saying it's the left anterior and the right marginal, which I don't see on there. So we use 2 coronary arteries, bypass to the aorta. So open bypass with autologous arterial tissue 021109W. And the W is for the aorta. Also, qualifiers used for transfer procedures in the body systems, cutaneous tissue and fascia, and systems related to the musculoskeletal system. This is for transfer. And the rule is when multiple layers are involved, the body part value is for the deepest level, the qualifier value is for other layers. And here's an example. Musculocutaneous flap transfer of the shoulder muscle. It's in muscles, transfer, the body part value is the shoulder muscle, the deepest layer. And then the qualifier is skin, because it says cutaneous. So we have musculo and cutaneous. Transplantation is another root operation that uses qualifiers. In the heart and great vessels system, the qualifier describes the type of tissue: allogenic, syngeneic, zooplastic. And here's a definition of those. So it gives additional information. Open heart transplantation, no device, zooplastic. And what kind of tissue was used? Zooplastic. So animal heart. The root operation creation also uses qualifiers to fully explain what happened. Creation is used in making a new genital structure that does not take over the function of a body part. This is a sex change. So for the sex change operations, you're going to go to general anatomical region. The body part value is the sex the patient was born with. The qualifier value is the new sex. So, for example, sex change from female to male using non-autologous tissue. We have from female to male, the tissue being created. So together, that gives you the information that you need. Root operation is also used in the heart and great vessels body system. This is for creation of a new heart valve. The qualifier value is the tissue used to create the valve. The body part value is the valve being created. So this is what's being created. This is what tissue is being used to create the valve. So for example, creation of a new mitral valve from the patient's common atrioventricular valve, which is a birth defect. You can see that it's all open between all the chambers, and the blood flows freely between all of them, which is not what you want, because you want to separate the oxygenated and the non-oxygenated. So what they do is make a new mitral valve from this common tissue in the common area, 024G072. So autologous tissue, because it's using the patient's tissue. The new body part value is the G. The qualifier value is the tissue used to make the new part is 2. Qualifiers are also used in body systems, upper and lower extremities, with the root operation detachment. This is really complicated. In the body system upper extremities, root operation detachment has values for body values for arm, hand, fingers, and thumbs. And then the qualifiers give you which part of the arm, the hand, or the fingers and thumb. In the lower extremities, the body part is leg, foot, toes, and then they give you these qualifiers: high, mid, low, complete, partial, and the raise, and complete, high, mid. So let's look at each one of those separately. So let's start with hand. So the body part values are just hand, right, or left. The qualifier values are both raise and whether it's complete or partial. Complete is through the metacarpal, the carpometacarpal here, bones. Partial is along the shaft or head of the metacarpal, so that would only be partial. The raise are which finger it is. You start in the thumb side, which is 1, and then you have 2, 3, 4, and 5, and with the pinky finger. So it's which side of the hand you have. That's for hand. For finger, it's a little different. The body part value is for specific finger. The qualifier value is complete or partial detachment. So you have complete metacarpal phalangeal joints. That's here in green. You have mid through the proximal or middle joints. You have low, the distal, like the tip of the finger. So also in the body system is for upper and lower arm. The body parts are upper arm, lower arm, right and left. The qualifier values are for upper arm, which is the humerus. It's here. You have high, mid, and low. In the lower arm, the radius and our ulna, you have, again, high, mid, low. So this is giving you more information. Well, they did a detachment of the arm. Which part of the arm? Lots of very specific information about that. So let's move on to the foot, the lower extremities. The body part values are foot, right or left. The qualifier values give a lot more information about that. Complete is defined as through the tarsal metatarsal joint. Partial is through just the metatarsal. The complete would be here. Partial would be here. And then again, it uses rays. Ray 1 is on the big toe side. Ray 5 is on the baby toe side. So finally, let's look at toe detachment. The body part gives the specific toe, right, left, whatever. And the qualifier, and you have 1, 2, 3, 4, 5. Complete is metatarsal phalangeal. High is up to the proximal phalanx. Mid is proximal or middle phalangeal joint. Low is down here. So finally, we'll look at leg detachments. The body part value is for the leg, which leg, right or left. The qualifiers are for upper leg or lower leg. So for upper leg, you have high, mid, low, then where it is on the shaft of the femur. And the lower leg, you have high, mid, low, where it is on the tibia, fibula. Okay, pretty confusing, but get these definitions down in your book, and that should help a lot. Now let's move on to replacement procedures, also in the upper extremities. The body part is the tissue being replaced. The qualifier value is the tissue that was moved to replace this. So for example, for replacement of the thumb, different values for right or left, they're using the toe. You can see the difference. This is a toe that's used now as a finger, and this is a regular finger over here. So the tissue used to replace the body part is the toe. That's the qualifier. Replacement of patient's right thumb with his left toe, 0XRL07P. So the value being replaced, tissue being replaced is the thumb, being replaced by the toe. That's the qualifier. So more replacement values. In the upper joints, the qualifiers are also used to give more information for replacement. So for example, for body part value shoulder, the qualifier values indicate the area being replaced, the humeral or glenoid surface. So for body parts removal, similarly, in the lower joints body system, the body part value is the knee joint. The qualifier value is what part of the knee. In this case, the patellar surface, the synthetic patellar surface. So which part of the knee joint is being removed of a previously done surgery. So replacement is also used in the female reproductive system. So for hysterectomy procedures, the qualifier value indicates this was supracervical, only in the area above the cervix. So supracervical we have here. This is the cervix, this is the vagina, and so sometimes hysterectomy is here, sometimes it goes a little more, but But in this case, the qualifier value says no, only the uterus was removed only above the cervix. Now, body part values, qualifier values sometimes include the number of body parts. For example, in the body system, mouth and throat, for all of these root operations, you have body part values for teeth. You have upper tooth, lower tooth. The qualifier values give you more information. Was this one tooth? Was this several teeth? Or was this all of them, like all the upper or all the lower? So in the skin and breast, there's also qualifiers for destruction of lesions on the skin. So this is for numbers again. So skin and breast, you have destruction, and then you have specific, the body part is a specific area of the skin. The approach value is external, no device, and then you have multiple lesions or no qualifier, which will only be if there's just one lesion. So finally, now let's move on to qualifiers that provide additional information for approaches. These approaches have qualifiers that deal with, these systems have qualifiers that deal with the approach. Upper joints, heart and great vessels, lower arteries, upper arteries, lower veins, upper veins. So let's look at fusion. In fusion procedures, the qualifier provides information about the approach used. So the approach may vary in that, but you have anterior approach, anterior column, anterior approach, posterior column, posterior approach, anterior column. So here's the anterior column towards the front. Here's the posterior column. So what's the approach and where are they going for? The anterior column or the posterior column? Which column or is going to be treated? There's also interesting qualifier value for insertion procedures in the lower veins body system. This also includes qualifier approach values in the qualifier. So sometimes a newborn who still has an umbilical cord or a stump will need administration of fluids, medications, or possibly blood. So you go to the lower veins, use insertion, inferior vena cava. Approach is either open or percutaneous, but the important part is the qualifier says through the umbilical cord. So that gives a lot more information about the approach being used. There's also approach values about replacement. This is how it's the procedure is being done. The approach says percutaneous, but the qualifier says transapical. So you see that's from here as opposed to the other possible approaches. So that gives you a lot more information. It's percutaneous, and the device is the type of valve replacement that's being used, but the qualifier gives you more information. Replaced using what approach? This one. So qualifiers may also include additional information about devices. So we've talked about qualifiers dealing with approaches and body parts and other areas, but also it includes devices. So qualifiers may provide additional information about devices. And here are some body systems where that occurs. Upper lower arteries, skin and breast, lower joints, and heart and great vessels. So in skin and breast system, a replacement option may include a specific type of flap using autologous tissue. So you know that it's autologous tissue, that's the device, but the qualifier says full thickness or partial thickness. So that gives you additional information, what kind of device, what kind of tissue. You also have a type of flap, which is all of these: gluteal, superficial, transverse rectus abdominis cutaneous, so the type of flap. So you have autologous tissue substitute, what kind, and then it gives you a specific type of flap used. And this is in replacement for breast. So let's look at compare the device and qualifier values. It's interesting the different terms are used in this. You have device value, autologous tissue substitute. Qualifier value doesn't have any because it uses more specific. So you have autologous tissue substitute, non-autologous. Qualifier value has allogenic, syngeneic, suplastic, and none. So non-autologous is used in these two for device value in these three, but the qualifier value gets more information on what kind of non-autologous tissue, what kind of autologous tissue. So it gives more information. When you use those two together, it gives more information. For dilation procedures in the upper and lower arteries body systems, the device intraluminal is further defined as a drug-coated balloon. It may not be a drug-coated balloon, but if it is, then you're going to use qualifier value 1. It gives more information about the type of device being used. Sometimes qualifiers indicate that a device is used only for a short period of time. For example, device value short-term external heart assist system, intraoperative is the qualifier value. This is in the heart and great vessels insertion. So you insert temporarily an external heart assist system. So there's no way you can remember all the guidelines in this PCS book. Actually, qualifiers don't have any guidelines, but they're kind of hidden within some of the other guidelines. So here's some suggestions of things to write in your book to help jog your memory. For creation procedures, make note that for sex change operations, the body part value is the original sex, the qualifier value is the new sex. For heart valve procedures, the heart body part value is the valve being created, qualifier value is the tissue being used. And don't forget for bypass procedures, note that the body part is bypassed from, the qualifier is bypassed to, and together they give a whole picture of what happened. Now for detachment and replacement procedures, there's a lot of information there. Which ray is it, high, low, mid, so partial, complete, and those are all defined in this video. So you might write in the definition of rays, what's partial, what's complete, and what's low, mid, and high. That completes this video. If you have questions or comments, please feel free to contact me. And here's where you can contact me. I'd love to hear from you. And again, I've written books on coding. These are available on Amazon. You can use this link, or you can just go to Amazon Books and type in my last name, Tropin, T-R-O-P-I-N. Thank you so much for listening. I hope to have more lessons up soon. Thank you.